brand new episode of Youth Diary. Today's discussion topic is problem related to the youth. And to discuss on this, we have Dr. Mohanan, Pulmonologist from Renai Medicity, Cochin. Hello sir, welcome to our show.
Thank you.
Doctor, first, how do you define youth? Is there any definition for youth?
In fact, youth is an entity which cannot be precisely defined. This is because the transition from childhood to adolescence and from adolescence to adulthood is a continuous process. There is no clear-cut boundaries between these. But anyway, there are a few arbitrary definitions and age-specific definitions with respect to youth. United Nations segment UNESCO defines youth as a period of transition from the dependency of childhood to the independence of adulthood with ample awareness of one's existence as a citizen in the community with interdependence. This definition has got some defects, like when do you become an adult? Adolescence or a youth is the period when most of our time is spent for education and search for a job. Once you attain a job, you are an adult because relatively you are independent. But in the current scenario, with unemployment and all, the period of this transition is upper age limit of this youthful to adulthood transition is receding. So there is no clear-cut age limit for this definition. But anyhow, for practical purposes, UN says that each member country can have its own age limit for defining youth. UN again defines youth as an age between 15 and 24 years. This is the UN. And for African Forum of Youth, this is different. This is from 15 to 35 years. As far as India is concerned, it is said that youth is the period between 13 and 35 years. This is again subdivided between one segment between 13 and 19 years. This is the teenage group, and the second is from 20 to 35 years.
Now doctor, let's go to our next query.
I am just Lawrence and I am from Saraswati Vidyanidhan. And my question is that are there any problems peculiar to young women?
Of course, when compare the gender, male and female youth, there are problems which are common to both, but some problems are specifically applicable to the young women. Most importantly, this is the sexual abuse which we come across, whether it is at the public places or working places or even under home situations. This is a real problem which the many women are silently suffering, and very few are dare enough to protest and take an action. There are other problems which women alone are suffering. There are a lot of single parent family where, in the sense that the mother, the young woman is destined to look after the whole family on her own. He had to generate the income, take care of the children and look after them like the whole family. Even if there is a father, he may be drug addict or may be having some problems. With two parents, woman is exclusively looking after the child. And there are another group with the divorcees. And then taking the divorce into consideration, it is the mother who is affected most because he is supposed to look after the children. The children quite often go along with the mother. With the same situation, added burden to the mother. Third is teenage motherhood, like illegal pregnancy. The woman is left around and she is supposed to suffer. The child may be going to the orphanage or somewhere. These are the main feminine specific youth issues.
Okay. Now let's go to the next query.
My name is Mary Titi Joseph and I am from Saraswati Vidyanidhan. Sir, can you tell me what are the problems affecting the youth?
The youth must be aware of its potential. The young women and young men form the largest segment of our population. They are almost 30% of the total population. And youth is the most vibrant and dynamic and creative and productive segment of our nation. It is the youth which are protecting us from the borders. The total military power is our power of our youth. It's a youth that is affected mostly in the war. So, recognizing the problems of the youth is of very high significance for the nation. After what is health? Health has got a physical, mental and social dimension. WHO defines health as a state of complete physical, mental and social well-being and not merely the absence of disease or infirmity. Two important determinants of health. One is, I would say, lifestyle and environment. If you have good lifestyle, if you exercise regularly and if you have a concern for the environment, 70 to 80% of diseases can be prevented. In this era, the youth are being affected by so many lifestyle diseases which are affecting the adults by above 45, 50 years. A lot of young hypertensive, young diabetics, young people are developing a heart attack and also smoking associated diseases which we call COPD. Previously it used to affect people above 45. Now the young people are coming with symptoms of chronic obstructive airway disease. So this is very important. We must love our population. If you love our people, you should definitely love the environment, the ecosystem. See, in spite of so much of urbanization, what is our state of sanitation? What is the state of our waste disposal? You walk around in the city and all. Here and there, carelessly people are throwing all sorts of waste. Somebody who should flush my own toilet? It is myself. You should not wait for other people to do it. So this concern for the environment is not a response with the government alone. Each of us got each young youth and all of us got individual responsibility towards the environment. That I would say with so much of exclamation. I will say, take care of the environment. You take care of the mosquitoes, flies, clean air, clean environment. Almost 70 to 80% of the diseases can be prevented. Here what happens is you are creating diseases and again treating it, again diseases coming out. It is a vicious cycle. If this has to be broken down, you must have a strong point in mind, that is healthy lifestyle, exercise and the concern for about the environment. The youth has to take these facts into their mind, in their heart.